Let's take a look at chronic disease temperature biomarker number 6, white blood cells. White blood cells are the most fundamental part of our innate immune system. They're produced in the bone marrow and the thymus, and they attack primarily infection. Now, there are several types of white blood cells. We have monocytes, eosinophils, basophils, lymphocytes, and neutrophils. All of these taken together, when they're measured by your laboratory on a blood draw, give you your total white blood cell count. So let's dive in. So white blood cells primarily fight infection. Here's a really cool video of a white blood cell in action. Here's white blood cells, bacteria. And you can see the white blood cell chasing the bacteria and eventually encapsulating it and sequestering it and destroying it and taking it out of your body. So white blood cells are involved in cancer. We often think of cancer as a separate chronic disease from diabetes, Alzheimer's, and cardiovascular disease, for example. But there's a strong link between inflammation and the development and progression of cancer, just like there is with diabetes, just like there is with Alzheimer's and cardiovascular disease. So we also see that white blood cells are found in large numbers in tumors. And lastly, the quantity of white blood cells correlate with tumor stage and prognosis. So yes, they're found in the tumor, but they're also found in the peripheral blood. So when the white blood cell counts go up, that could be a sign of cancer. It could be a sign of any number of inflammatory chronic diseases. But the point is, you want to improve your health and lower your white blood cell count. So here's the standard of care, 3.4 to 10.8 counts, and our ideal value based on our mortality studies are 4 to 6. So quite a disparity. So how did we get that number? So here is a Harvard University study from 2005 and what they determined. And this is from the Nurses' Health Study and the Women's Health Initiative. Huge study of over 100,000 women that shows that white blood cells predict heart attack risk and, more importantly, fatal heart disease and fatal heart attacks, and that at a count of 6.7 compared to 4.7, you double the risk for fatal heart disease, heart attacks, strokes, things of that nature. And you can see that the standard of care at 10.8, you'd be considered very normal at 6.7, whereas with our value of normal, 6.7 is abnormal. This is the difference between acute infection and inflammation versus chronic. Here's people that have chronic subacute infection and inflammation leading to slow and steady deterioration of their vessels and of their tissue, leading to heart disease. Cancer is included in that as well. So here's cancer mortality, and this is a very large, well-established study looking at cancer mortality based on white blood cell counts. And what we see is that at so-called quartile 2, at between 5.8 and 6.8, once again well within the standard of care, we have a significant increase in mortality rate. And that mortality rate increase from less than 5.7 to the 5.8 to 6.8 range is a 32% increase in cancer mortality. So obviously the standard of care is looking at acute. We're looking at chronic, and most disease and most things that cause us to feel poorly is chronic in nature. So when we look at that data from that chart, that table, what we see is a steady increase in cancer mortality risk as the white blood cell counts go up. And even at this level, we're still potentially within the standard of care. So what we see with white blood cell counts and early mortality is a classic U or J curve, where at the low end of the spectrum, we see high mortality, and at the high end of the spectrum, we see high mortality. And somewhere here is optimal, where everybody wants to be. Let's look at what that is. So here's the standard of care, 3.4 to 10.8. And you can see there in a regime where mortality, all-cause mortality is going up. And obviously on this end, we're seeing the same thing. And this is where we want you to be, in this range of 4 to 6. So there you have it. White blood cell counts, an inexpensive, easy to obtain test. Most doctors' offices are drawing white blood cell counts. They generally are looking at it from an acute perspective, but you can see the chronic perspective gives a very different view on your health, and you want to be within our range of 4 to 6.0, that is. Dr. Tom Lewis here. Thank you very much for your time.